Welcome back to Get Moving. We're joined today by a resident of Moore Park, California, Renee Nutley. Renee, what brings you to our show today? First of all, why don't you tell us a little bit about yourself?
I have two boys that have muscular dystrophy. They're 23 and 21, and we're trying to take care of them at home. And we just want to talk about that a little bit. I also teach school at Fillmore Unified School District, and they've been very accommodating in helping me take some time off here and there when I need to take care of the boys. And I'm very grateful, and I just would like to thank them and thank Dr. Landon for being so concerned about kids with disabilities.
Well, you and I talked quite a bit on the phone, and Dr. Russell, who's been on our show before, is head of maternal and child health for the county. Tell me a little bit about what your day is like. When does it start?
My day starts at about 5:30 in the morning. I get up to get ready for work, and then I brief the caregiver on shift change and what needs to happen during the day and what happened during the night. I talk to the night shift person to make sure everything went okay and that all the equipment worked adequately, and if there's any problems that we're heading into the day with. And then I get ready for work and pray that shift change goes well. Then I teach remedial reading, and at recess and lunch I call home and check on everybody and do some networking to get services that they need. And then I come home and talk to the caregivers and just be a family and deal with all the medical issues that come into our household.
Well, it sounds like an episode out of ER, shift change and nurses and caregivers. Do you ever have emergencies in the house? I mean, this is, we were talking earlier that even having a fever of 101 will bowl over most moms. What kinds of things happen in your house?
One time, Robert got a hot dog stuck in his esophagus when I had a really wonderful caregiver there. His name was Charles. He works at Los Robles now, and he did a really good job. And he called 911, and they had to get a GI doctor to push the hot dog on into his stomach. Right now, most of our medical issues are related to aspiration issues, getting choked and dealing with that.
Well, how does that make you feel, though? And I mean, they forgot to send you to medical school first. But
well, some days I feel ready for the challenge because I feel like I have a lot of support because we have you and we have really good equipment and we're doing some things that are really proactive. And we kind of get used to that kind of constant state of emergency with the choking and stuff. But other days are difficult.
So how do you keep your life in balance? I know your folks are here today.
When you're dealing with this, there's really, balance is not the goal. If you're trying for balance, you're not going to get it. You're just going to have to live one day at a time. And
how was today?
Focus on what's important at the moment.
Yes. All right. I promised you a Kleenex box there. The hard part, we have certainly have a lot of equipment in your house, and we have ventilators for nighttime for the boys, and cough-lators to suck the mucus out. And
the cough-lators are life-saving every day.
And then we're using a therapy vest to help move things along too. I know that the boys feel like one more thing is going to break their back there.
With the boys, they are very bright and they communicate and they want to know all the science behind different pieces of equipment. So in some ways this project, I call it a project, has made them exposed to a lot more medical knowledge than the average kid their age, and they want to know all the details before they commit to any type of procedure.
Well, does that lead to any conflict for you? It's hard being their mom and having these intelligent boys questioning everything, because that's everything that a normal child goes through with their parent, they go through with you too.
I think it leads to even more conflict than in an average family because, for example, Peter's in adolescence, he's a young adult now, and most young adults are really making a lot of their own decisions, but the decisions Peter has to make are really life and death decisions on what to do, what therapies to choose to take advantage of. And sometimes he feels like he has 6 mothers because all the nurses are asking him, are you okay? When he coughs, everybody's asking him, are you okay? Are you okay? Do you want to do cough assist? Do you want to do Zopanex? Do you want to do a nebulizer? You know, what do you want to do? And myself and most of the caregivers and nurses really want to intervene before he needs the intervention because we're sort of planning ahead. So it's hard for me to want to wait for when he's ready because I want to do it a little proactively. He's a little wanting to wait longer to do certain things. So he kind of gets upset when you want to offer the assistance too soon because he's like, I know what I need. And he does, and he's 23. And so with kids with disabilities, they haven't often had as many choices to make growing up or the opportunity to deal with the consequences of their choices. And so then all of a sudden they're having to make, real big decisions like, do I take this treatment or this therapy? But
Well, the kinds of things that you do in the house too. I mean, basically you have a hospital in your home. We were talking earlier just trying to estimate what the costs of therapy are. And you're certainly doing the job of someone who's been to nursing school and respiratory therapy school and doctor school and pharmacy school. And so in terms of your insurance companies, has it changed at all with time? I know our governor is sure looking at universal coverage, but
we're
what's gonna
having
happen
a
to-
really hard time each year, and insurance companies and businesses and school districts renegotiate the insurance plans. And each year, the insurance plans offer less and less coverage. For example, 5 years ago, when Peter and Robert had their spine fusion, I was able to get skilled nursing facility benefits 190 days in the home. Robert came home with a PICC line and everything from the hospital, and we were able to get really good insurance coverage. But now what I'm finding is that even though they have insurance through my job, and they have Medi-Cal in addition, we're having trouble getting the level of care that we need. The insurance companies, for example, have a $3,000 limit on durable medical equipment, and I think one cough-ventilator machine is like $24,000. Am I close?
Well, about 6 for the cough-ventilator,
Yeah.
12 for the vest, and
Yeah, so all together it just...
yes, we're up there.
And then you have to wait lots of time for Medi-Cal to approve things. And even the companies that take Medi-Cal are having trouble getting reimbursement quickly. So it's getting harder and harder for anyone with or without insurance to meet the medical needs financially.
Has CCS been helpful? I know you're on the phone with Dr. Russell, and
Yeah.
do you have a nurse coordinator there?
Dr. Russell and Karen Normington at California Children's Services, they both have hearts of gold. And Dr. Russell spent hours and hours and hours writing letters to Medi-Cal to convince them to provide skilled nursing benefits in our home for us. And he was successful. And Audra McClintock also helped with that process, and we were able to get nursing authorized. They authorized 8 hours a day of nursing for each boy, and then they authorized 8 hours for night shift also. But the reality between what was authorized and what we're able to get is really challenging because the agencies are not able to staff the case. Because we only have 1,500 nurses living in Ventura County. Those are LVNs. There's more RNs too, but the level of care that was authorized is LVN level care. And there's 800,000 people in Ventura County. So we're experiencing a really serious shortage of nurses. And apparently it's taking 2 years for some kids to get into nursing school. So there's agency issues interacting with my reality